Welcome back to the Now Morning Show. Tobago Thursday continues, and of course, as we are in the month of May as Mental Health Awareness Month, we are speaking with counselling psychologist Rhonda Thompson-Benjamin. We're going to explore how positive communication in families is essential for building strong emotional connections and a supportive home environment. Taking a look at how open, respectful dialogue encourages understanding and helps address mental health challenges early. Good morning, Rhonda, and welcome.
Good morning to you, and thank you so much for having me.
It's a pleasure to have you with us on the show this morning. Thank you for joining us. Let's jump straight into the conversation, that correlation between family members' mental health and the entire family system. What exactly is it, and how does it work?
Well, I am happy that we are able to have this conversation because the theme for Mental Health Month is actually community, and our family is our first community. So I think to help us understand the dynamic is to view the family unit as really an organization. If one employee is not functioning optimally, of course, projects will be delayed, which can affect the entire organization. And similarly, if one family member has mental health issues, it can really disrupt family roles and routines and the dynamics of the family in general. So, for example, anxiety, and depression in one person can create emotional strain, miscommunication, or even conflict among other family members. Additionally, family members may experience guilt and confusion, resentment, and they may need to now adjust to this mental health issue and may also need to seek support.
Now, Rhonda, just speaking from that, one of the things, of course, we need to be aware of are the signs. What are some common signs of mental health struggles within a family unit that we need to look out for? And maybe does it differ depending on the age of the individual, for example, parents versus children?
Yes, it may differ. So, first of all, you have to know the members of your family. You have to become acquainted with their temperament so you would know if something is off. So, for example, you may have an introverted family member, and that may be their normal way of operation. So, you have to know your family members to notice any changes. So, looking at the family, some common signs would include increased conflict or withdrawal, changing in sleep and eating habits, and there is that big issue of communication, the lack thereof, emotional outbursts, decline in school for children and even for adults, decline in work performance. Children may also show some behavioral issues. They may regress developmentally. So maybe they would have grown out of this stage of wetting the bed, and all of a sudden they start to wet the bed again. All those things are signs that there is an issue. For adults, they may even appear very overwhelmed or disengaged. So we have to pay attention to these common signs to be able to identify issues and also access help for our family members.
Now, Rhonda, when you talk about this specifically, paying keen attention, is this also something that can lead into, let's say, determining whether or not something is clinical or something is perhaps for a time? For want of a better expression, of course. And many times, in addition to that, we're also told about coping mechanisms. But how do we differentiate between when we need treatment versus coping?
Yeah. And I think the difference there is the duration and intensity. So, for example, as families, we may go through difficult experience such as grief and loss. There might be a transition. You move from one country to the next, and naturally there would be some anxiety because of these changes in the family dynamic. However, if these symptoms, if these signs extend for a very long period, So months are going by and there is not equilibrium. There is no form of settling or calm within the family. Maybe we need to look at that a bit closely, and you can reach out to a professional to be able to guide you through, especially in children. At school, there are guidance counselors, there are social workers that may help children settle in these new phases. So we have to be able to look at the intensity and the duration of these issues to be able to decide whether or not it's something that's clinical.
Now, Rhonda, in a scenario such as that, how can families support that particular family member when they are experiencing a mental health condition?
Yeah. Well, the first thing that a family member could do or families can do is to listen without judgment. Sometimes persons just want to know that they are feeling supported and understood. But many times in the Caribbean context, because something is not a personal experience, we can demean that person's experience. So we have to be able to listen without judgment. Encourage that person to get professional help. Also, learning about the condition. If that person is diagnosed with something, you may find behaviors that are strange and then resentment could build. But if you do research regarding this medical diagnosis, you would be able to have more empathy for that person. At the same time, we have to set boundaries. We have to maintain a routine. And we also have to get that person who may or may not be diagnosed with a mental health issue to be involved in the decision making so that we could preserve dignity and stability. So having that person involved as much as possible in the decision making process of the family.
No, Rhonda, I definitely hear you, especially when it comes to the boundaries, because sometimes it can admittedly be quite challenging when you have a family member,
Yeah.
somebody within your unit who is living with a mental health condition. And communication definitely comes up over and over again. What strategies would you recommend, and how can we better communicate with those within our lives who are experiencing mental health issues?
Yeah, I think open and honest communication while having that empathetic approach is very, very important because this fosters connection and it allows issues to be addressed without escalation. So it really builds trust and it encourages problem solving to ensure that these members of our family, they feel heard, they feel valued. So because of different mental health disorders or conditions, issues, persons may not be able to interpret um, content or information in the typical way. So that is why other members of the family may need to seek counseling and also find support groups so that they can better understand how to communicate with their family member.
Yeah, something that is so important. And speaking about all of these different things, another thing that we would have referenced earlier in our conversation would have been coping strategies, especially when it comes to the transitions you would have mentioned within life, grief, migration, and all those other facets. What healthy coping strategies can parents particularly start to model and implement for their children?
Yeah, I think parents need to find a good balance between work and self care. Parents need to model expressing emotions in a healthy way and also showing your children when you need to seek additional support. Parents have to manage stress constructively. Also, another thing that parents can do is to be open about challenges based on the child's age. Sometimes we try to shield that child from every single thing that we might consider negative. However, children need to understand that life has ups and downs, and sharing with children how you navigate challenges is important to help them to handle their own emotions when they experience difficult scenarios or situations.
And that's something, agreed, that is critically important. But as you mentioned, that particularly, many times we do see situations where parents may show the navigation not in the healthiest way to the point where children are almost treated as adults. How do we find that balance? Do you have any recommendations, particularly for parents, when it comes to approaching certain situations?
Yeah, excellent question. We have to remember that our children are at different developmental stages. So you may not have to give all details. So let's go, for example, with grief. You may not want to share every single detail about the scenario, how the person died, especially if it was a tragic accident. But showing your children that this is the reality of life, walking them through those situations, telling them that it's okay to cry, also acknowledging that this may be their first experience. As an adult, you may have had several other instances where you would have lost a family member or would have even viewed it on maybe the news or so, but this might be their first scenario relating to grief. So handle them with care while showing them the reality of life.
Rhonda, specifically as you mentioned that, something we always see, as you mentioned in the media, is we definitely see, unfortunately, sometimes graphic images, details in stories and that sort of thing. What is your perspective on the role of media and the relationship with children and parents, particularly?
Yeah. Well, firstly, I think that media has to understand that they have a wide reach. Everything that is posted is accessible to whoever, regardless of the age. So parents' responsibility is to be able to monitor the use of devices. There are parental controls where you can block certain things. You may not be able to block everything, but you have to be able now to guide your children. If you're unable to monitor your children effectively, then they may have to go outside, find another activity to engage in, because these things could really traumatize children because they may not have the capacity to cope, to understand the entirety of various situations. So it's partly media. They are responsible for what images they put out there, but parents too have to be involved in monitoring their children's use of social media and other platforms.
Now, Rhonda, in light of that, and of course many other factors within society and daily life, what strategies can families use to start to build emotional resilience, not just individually, but together as a unit?
Yeah, I think we started with talking about the family as an organization. And every organization, for it to function effectively, you have to have check-ins, you have to have meetings. So even if you are a very busy family, having a check-in once a week for 15 minutes, what was good about this week? What challenges did you have? To be able to hear from the youngest to the oldest member and come up with strategies in terms of how can we now navigate these challenges. When we meet, practicing gratitude. I am happy that you did this for me. Or, I am grateful that we have this time to spend together. All these things are very helpful. Maintaining routines, setting goals as a family, encouraging open dialogue, engaging in shared activities such as exercise or hobbies. All of these things can promote resilience in a family. Celebrating small victories and seeking help when it's needed is also important in strengthening the family unit.
Wonderful. Rhonda, we just have 30 seconds left in our conversation. As we close, can you advise what resources are available for families?
Well, first of all, in Tobago, at the Division of Health, Wellness and Social Protection, there's free counseling available. So you would want to check them out in Tobago. In Trinidad, rather, the Ministry of People, Social Development and Family Services. They also provide counseling. And of course, if you want to reach out to us at Equilibrium Counseling Services, you can call 376-3760.
Wonderful. Rhonda, thank you so much for joining us this morning. It's been a pleasure to have you. Have an excellent week.
Thank you. Same to you.
Rhonda Thompson-Benjamin, counseling psychologist, here with us this morning on the Now Morning Show. Stay tuned. There's more coming up after this break.